Hello, my name is Dr. Utkarsh Gandhi. I'm an orthodontist and specialized in cleft care for babies and teenagers. So today we had one patient with incomplete cleft and we have planned nasal elevator to improve the symmetry and shape of the nose before surgery. So what happens is when you use the nasal elevator, it helps to improve the shape and symmetry of the nose and helps the surgeon in improving the symmetry of the nose. So a lot of parents are not aware regarding the nose asymmetry. So early in age, when the baby is around 1 month to 3 months, this procedure can be cost effective and it can help in improving the symmetry of the nose for the babies. This is a very simple procedure where we just make a hook and it gets inserted in the nostril. To lift the nostril with the help of forehead, we just try to pull the nostril and improve the shape and symmetry of the nose. Also, it helps in improving the length of the columella, which is a soft tissue below the nose. The overall purpose of this treatment of nasal elevation is to get better result and better symmetry of the nose post surgery. This is quite painless procedure and you can do it at home once the orthodontist teaches you how to install the nasal elevator on the baby. You can do it at home and visit us every month to check the improvement. If you have any queries or doubts regarding this procedure, you can call on this number and contact us for solving your queries.